Hi, I'm Molly Sullivan with Tennis MD, your source for all your tennis health, fitness, and injury information. Tennis players can get IT band friction syndrome. The IT band acts primarily as a stabilizer during running and may become irritated from overuse. The pain and injury will cause tennis players limited mobility and misplay. Today we visit with Dr. Michael Meow, sports medicine orthopedic surgeon, to tell us more about IT band friction syndrome.
IT band syndrome, or iliotibial band syndrome, is a pain syndrome that affects the side of your leg. You can have pain either at the knee or at the hip or along the way. It involves a structure which is a very tough canvas type of tissue that connects your buttock muscles down to the lower part of your knee. Most of the time we see this in athletes who have sports which involve a lot of standing, running, positional uniqueness, like golfers, tennis players, and it involves a certain amount of tightness that are associated with the hip muscles and the low back muscles. The treatment for iliotibial band syndrome involves primarily flexibility and strengthening exercises to balance out the muscles and the tissue. It can also be treated in addition with anti-inflammatory medications, steroid injections, and very rarely would it require surgery. An athlete can play with these injuries if the symptoms are maintained. Quite often these are recurring or chronic-based symptoms that are managed. For certain sports like golfers and tennis players, we usually proactively continue treating these athletes on a progressive basis throughout their entire season.
Tendon is tight, which indicates that there's some sort of muscle imbalance around the area. So I really treat that in rehabilitation by doing a full evaluation of all the muscles around the hip and the lower leg, finding out what muscles are weak, what muscles are tight, in addition to the tensor fasciae lata and the iliotibial band, and then strengthen those muscles that are weak. And then you can also use modalities to calm down the inflammation. The length of time in this rehab can be, again, very quick. If the problem is addressed correctly, it could be as little as 3 to 4 weeks, or it could drag on for a long time and be a chronic nagging problem that could be, 6 months before it gets better.
Be sure to keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with TennisMD.com. Remember, at TennisMD, health equals performance.